that some of those things will happen. All right, so don't think that your wife has something has happened. Nothing has happened. Yeah, something happened with pregnancy. It's called pregnancy. All right. I'm designed to eat weird things. Is it normal? Yes. See, well, this is when a woman will now begin to eat chalk. You know, they call uzu. Uh, what is happening is it is leave me oh, is what I feel like taking. All right. All manner of things. Very, very strong cravings. Like I said before, if they are not harmful, why not? Some may just decide that all they want to take is just fruits, pineapple, grapes, guava, carrots. That's all. That's what they feel like eating. Some may decide all I feel like taking is shawarma. Just give me shawarma. Uh, and sometimes you bring that shawarma and you say, I've changed my mind. It has moved from shawarma to peppered goat meat. Ah! Oh, peppered goat meat now. To peppered goat meat. That's okay. Go and get me peppered goat meat. So please, men, understand with your wife. Okay? Their desires and their demands may become very unusual. Okay? That is not, don't need to worry, or because of the pregnancy. And some of these things may not last. You have one today, tomorrow change. There are some who just say that, see, all I want to be doing is just Indomie. Tell why? Just want to see Indomie again. So it all depends. Okay? So these are some of the things that you have, all right, and they are all perfectly normal. Okay. And then lastly, I am urinating too frequently. Is this normal? Just only realize that you are going to toilet very frequently. As you are coming back, you are going again. At night, you can hardly sleep. You go and pee, it's as if you've not finished everything. As you are coming back to the bed, before you know what's happening, you are going off. Sometimes it could be normal, sometimes it could be what? Abnormal. And when you're pregnant, early in the pregnancy, part of the symptoms of pregnancy is the early urination, which is due to the hormones. All right? And sometimes also due to the increasing size of the uterus. As the uterus begins to grow, particularly in the late stage of the first trimester and early second trimester, as the uterus begins to grow out of the pelvis to the abdomen, it begins to press on the bladder. So when it presses on the bladder feels full sooner than the normal time. And so you always have the urge to go and pee. All right? And then sometimes it could be due to infection. That's why I said it may not be normal. It may be due to infection. So once you're having these symptoms persistently like that, you may need to visit the hospital. Once you speak with your doctor, the nurse, they will know exactly if it is a normal phenomenon or if it's abnormal. And if it's abnormal, it's most likely will be due to infection, and then you'll be fine. All right. Okay. So these thank you for your attention. Any questions? Any question? Yes, that is also another. Yes, it can happen during the early stage and during the later stage. The later stage also is as a result of pressure. Okay? Now, what is bringing this pressure is sometimes the baby's head, all right, can be exerting a lot of pressure on the bladder, and then you feel like peeing frequently. So yes, thanks. So it can happen. It's normal. No, when we say those symptoms you feel during the early phase, some women it will not resume in the later phase of pregnancy. But some will not feel it, yes. It will not be, some will feel it in the all right. All right. So for the benefit of those who are just starting their journey, we will just take a quick presentation on what the first 3 months of pregnancy is like. Hmm? Oh, okay. Yes, yes, yes. I understand. Please go ahead. uh, so, if there are no questions from what we just presented, we'll just quickly do the first the first 3 months of pregnancy. Just to quickly let us know what the first 3 months of pregnancy is. It's a bit of some of what we said in this last presentation are there. All right. So the first 3 months is usually what we call the first trimester of pregnancy, and this phase differs from one patient to another. For some, it's basically uneventful. For others, it's full of drama. All right, because of the symptoms of pregnancy. Oh, the 3 months is full of serious drama. Particularly for those who are carrying multiple. All right, all their symptoms are exaggerated. They're plus, 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 depending on the number that they are carrying. So, like I said before, why some barely know if they are pregnant, they don't feel anything. Others would have a lot of symptoms. So the first 13 weeks of pregnancy is regarded as the first trimester. So when does this start? When pregnancy is confirmed. And this may occur at different stages. Most people are unaware, but for most of our clients here who you are aware of when you get pregnant because of the process led to it. So usually after you've had your embryo transfer, 2 weeks after you are confirmed pregnant, and then the journey starts. And there are some who already begin to feel pregnant even before they do their pregnancy test. So some already know, they already sense that they are pregnant before the pregnancy test is done. But it is the pregnancy test that is done, next slide, that confirms if you're pregnant or not. Because for those who go through IVF, sometimes you may feel very pregnant, have all the symptoms of pregnancy, but yet you're not pregnant. Because the medications that you're taking can sometimes make you feel as though you are pregnant. All right? But generally, these are the ways we confirm pregnancy. The symptoms that you feel, you do your blood test, urine test, and then the last confirmatory test you do is a transvaginal scan. That is a clinical, that's what confirms clinical pregnancy. The blood test confirms biochemical pregnancy. While it's a time of rejoicing and celebration, but we do know that for a few patients, the fact that they are pregnant chemically does not mean that clinically they are pregnant. That's why you have what we call chemical pregnancy. To see that person is pregnant, the blood test showed it. But after 2 weeks, when you do your scan, there's nothing inside. But that will not be our portion here. For those who are yet to do their scan. All right? Yes. So these are the ways you confirm pregnancy. All right? So what are the signs and symptoms? Like I said before, some don't have any symptoms or signs the first 3 months. And there are those who have it varies from person to person. So you have these following symptoms. You have nausea, vomiting, tiredness, sleeplessness, breast enlargement, tenderness, an increased or low appetite. Others will have abdominal cramps, spotting, mood swings, and then a change to smell and taste. There are some people that cannot, that some women cannot stand their husband now. Ah, no, 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 go, 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 go. Ah, what happened? It's hormones. You cannot use perfume around the house. Can't stand it at all. But some can even stand food. They are cooking in the kitchen. That is the end. Appetite is gone. But the good news is that all of those things, usually after 3 months, they all go away. All right. And then still on the symptoms, frequent urination, excessive salivation. A lot of us here probably would have experienced this. Okay. Then next, in a in the late first trimester, some will have abdominal swelling. Now, some will now begin to experience abdominal swelling. All right. Particularly those who are carrying multiple pregnancies. You know, there's some women, even 4 months, 5 months, you won't even know that they're pregnant because of the way their body is. Some, 2 months, you already know. But some, even before you even do tests, you already know that they're pregnant. But their tummy begins to show some um, manifestation depending on the number that they are carrying. A woman who is carrying 3, by the time she's 2 months, her tummy starts coming out. But that kind of woman, by the time she's 5 months, 6 months, you think that she's 9 months, she's ready to deliver. So they'll be asking, madam, when are you going to deliver now? In our mind, me deliver. If I tell you how many months I have, you won't believe. Why? Because she doesn't want to tell them how many she's carrying. Of course, you don't need to know. So it's not all women you see that are so heavy. You think that this one is ready to deliver. Some of them they are just halfway gone. All right. So when you have multiple pregnancies, the tummy becomes really very, very huge. So like I said before, if you are carrying multiple, then the symptoms of pregnancy become really very huge. Okay. So we usually do our clinical pregnancy determination using a transvaginal scan at 6 weeks, 5 days. So typically, what happens is that um, after your pregnancy test, which is 2 weeks after your transfer, then 2 weeks after your pregnancy test, you come for your first transvaginal scan. By which time we would have been able to determine a heartbeat. All right. So that is when that is done. And when you are coming for that, you are usually about 6 weeks, 5 days. So the way we calculate is not the way you calculate. So when you are confirmed pregnant, the day you are confirmed pregnant, hmm, you are already 33 days pregnant. That is, you are 4 weeks and 5 days. The day we say, oh, congratulations, you are pregnant. You're already 4 weeks gone, 4 weeks, 5 days. Yes. By the time you are doing your first scan, you are 6 weeks, 5 days. You want to know how? The day we do your transfer, that you're already 19 days. The day that embryo is put in. Because the way we calculate for your pregnancy, is from your last menstrual period. So if you got pregnant spontaneously, we will calculate from your last menstrual period. And we used what we call the Negelis rule. And a woman who has a 28-day cycle, the day she ovulated is the 14th. And then the day the fertilized egg begins to implant in her womb is after 5 days. All right. Now, we do the 5 transfer, meaning that the embryo has stayed 5 days in the incubator. So you add that 5 days to 14 days. That is how many days? That is 19 days. By the time we are doing your transfer, technically your pregnancy is already 19 days. 2 weeks after your transfer is when you do your pregnancy test. So you add 2 weeks, that's 14 days to 19 days. That's how many days? 33 days. By the time you are doing your pregnancy test and you are confirmed pregnant, you are 4 weeks and 5 days. Then by the time you come 2 weeks after for your scan, your first transvaginal scan, to confirm clinical pregnancy, you are 6 weeks and 5 days. Thereafter, you start counting. So, all of you take note now. So that way, you're able to calculate how many weeks. And we use weeks, we don't use months. I know people like to use months. How many months I am? Say I'm 3 months. And 3 months is not equal to 13, it's not equal to 12 weeks. So yes. Is 3 months equal to 12 weeks? No. Because why? A month is not 4 weeks. A month is 4 weeks and 2 days. 4 weeks and 3 days. A lot of times we want to throw away those 2 days and 3 days. And we don't throw them away, we calculate them. But every day matters. Yes. So, and that is why a full term pregnancy is 40 lunar months. Lunar month is 4 weeks exactly. So we don't do lunar months, we do calendar months. And so that's why a full pregnancy will last 9 months. All right. And so 9 months is not 36. Technically, 9 months is 40 weeks. Okay. Yeah. So when you are calculating, as you're doing weeks, I know a lot of you like to do months, so you understand that. Okay. So we've talked about hyperemesis gravidarum. We said excessive vomiting could be a challenge that could require um, admission. Next slide. And so the fetal growth begins to grow. These are the stages through which the baby grows. At these first 3 months of pregnancy, the vital organs of your babies are formed. And that is why the first trimester is the most critical phase of a woman's pregnancy. If there's going to be anything that will harm the baby, it will happen in the first trimester, particularly between the 5 to 8 weeks of pregnancy. The woman wants to take any medication that will harm the baby, take it within that period to have detrimental effects, because all the organs of that baby have formed between the fifth and the 8th week. All right? So that is the phase of organogenesis. So any baby that is not doing well will end up in a miscarriage. So why it may be very disappointing for a woman to have a miscarriage, because up to 25% of all pregnancies will end up in miscarriage. But do you know why God did it like that? It's so that we don't have abnormal babies. Because the process of human reproduction where babies are formed is not a perfect science. There are sometimes you could have severe abnormalities. The process of formation is not going well. Rather than that baby continue to grow and you deliver something that is not desirable, what happens? The body will just stop it. And then you have a miscarriage. So while it may be very disappointing for a woman to have a miscarriage. In another way, it's a blessing in disguise. So it's better for a woman to have a miscarriage than to have an abnormal baby that is born. That's why sometimes when a woman gives birth to a fairly deformed baby, it was actually a defect in the woman's capacity to recognize that this baby was not properly formed at the beginning and stop the process. Okay. So said up to 20% of all pregnancies will end up in a miscarriage. But our prayer is that for all of our women who are pregnant, there will be no miscarriages because your pregnancies will do very well. Okay. Next. Okay, so during this first trimester is when you could have threats. Okay. Most pregnancies in the first trimester would go on to the second trimester. But like I said, up to 20% will not. All right. And the major reason is because the pregnancy is not doing well. So the major cause of miscarriage in the first trimester is usually due to a fetal abnormality, which can either be genetic or chromosomal. So like I said before, if you're having severe abdominal cramps with vaginal bleeding, that could indicate a miscarriage. Now, some threatened miscarriages survive the scare, others don't. Some may end up as blighted ovum, missed abortion, incomplete abortion, or a complete abortion. So when we say a blighted ovum, it means that the woman is pregnant, there is a sac, but the baby is not there. She pregnant, yes, but it's called an embryonic pregnancy, where you have a pregnancy, there's a sac, but there's no baby inside. Sometimes it does happen. What do you do? Pregnancy has to be terminated and then the woman evacuated. And then you have what we call a missed abortion. A missed abortion means baby's heartbeat just stops. And the woman doesn't bleed. It's when you do a scan, you now realize that the heartbeat is not there anymore, but she's not bleeding. So that's what we call a missed abortion. What do? You need to evacuate. All right. Now let me go on to the next one. I don't like talking about all these things, but the way your face is all looking at me now. Eh? Oh, oh, please nah. Okay, I skip. Let me move to the next one. It won't happen to anyone. Oh, no, that one is not that portion. Okay. All right. So medication, very important in the first trimester. In pregnancy, generally, it's important that you don't take medications anyhow. But more importantly, in the first trimester. Okay. So you avoid medications as much as possible. Only folic acid or pregnant care is enough. So those are the things that you take. Of course, for those of you who got pregnant through IVF, at this phase is when you are taking your luteal support. That is perfectly fine. You must ensure you take your luteal support. All right, so that the pregnancy is sustained. Then you can start your anti-malaria in the second trimester, and then consult your doctor if you must take any other medication. Next, nutrition. So what do I eat? Doctor, I'm pregnant. What do I eat so that my baby will be healthy? Maintain your normal balanced diet, fruits, lots of water. All right. We normally say that women should avoid potash, anything that contains potash, soup, all of those abacha, all those things that contain. Women like to eat. You avoid it. Okay. Avoid spicy food because of the stomach upset. So some people they like people they like pepper. Oh my god. If there's not enough pepper in the food, the thing it will flow. I don't like pepper. Oh. Please, I think I don't like pepper. Because there's some kind of food that some people will eat. I can't eat it. But the pepper will be too much. So you avoid anything that is spicy. It's not because it will affect your baby. Because whatever you put into your mouth, it goes into stomach. It's not close to the baby, but it's just that it may create a lot of upset. All right. Okay. So other tips: get a lot of rest. Continue with your luteal support for those who conceive through IVF, and then after that, you register for your antenatal care. So for us here at this center, when do you register for your antenatal care? Officially, when you are doing your luteal support, you already have started your antenatal care, but it's a pre-antenatal care for us because you've not officially registered for antenatal care because some women will go to other facilities after they've completed their luteal support to register for antenatal care. Right? So officially for us is after you have completed your luteal support, in which case you are already in about 12 weeks loss and you've most likely done your cervical sacrilege, and the following week you can register for your antenatal for those who are having their antenatal year. For those who will not have the antenatal year, at that point you're given the report and then you can go and register in any other hospital of your choosing to have your antenatal. All right. I've mentioned cervical sacrilege. Some are saying, is it compulsory that I do cervical sacrilege? Not really. Cervical sacrilege, it's a stitch that is put around the neck of the womb of your cervix. It's put around your cervix, that's the neck of your womb, to support the pregnancy. Why do we do this? Some patients have what we call an incompetent cervix, meaning that the cervix opens up before time. And the only way you can know this is if a woman has had such experience. And here you have a woman who has never had the opportunity of carrying a pregnancy up to that level to determine whether she has an incompetent cervix or not. And now she's pregnant after so many trials, after many years. You want to take her through that process of knowing whether her cervix is competent or incompetent? No. So what we do, we just put a stitch. That's why we call it prophylactic. It's more preventive. Yes, she has not had the history, but we don't want to know whether she will have it or not. Let's just put something there just to secure. And so that we usually do at the end of the first trimester after she has completed her luteal support. And then it goes on into the second trimester. So for everyone who has crossed the first trimester into the second trimester, I say congratulations. You are now at your cruising stage. For those who are still in their first trimester, well done. Your journey has begun. You are doing well. And for those who are in their third trimester, I say super well done. You are close to your delivery, and we wish you well and wish you a safe delivery. Thank you very much. Questions? Any question? No? That question is it a question for me or for your husband? Ask, ask me. Can you imagine? Eh? At home, you can ask your husband anything. But you've come to hospital, you're still asking your husband. Oh, you thought you wanted to ask some money? Mm-hmm. Mm. Okay. Okay. Thank you very much. That's a very good question. So, there are some women who have multiple pregnancies early, and somewhere along the line, maybe one of the babies will stop doing well, stop breathing. We don't do anything to them. The body just begins to absorb them gradually, gradually. If it happened early, say in the early first trimester, by the time you are delivering, you will never see it again. That's what they call vanishing twin syndrome. Where in the first trimester you made the diagnosis, this one you are carrying two, and then suddenly it has disappeared. It didn't disappear. It stopped growing. The body began to absorb it, and then after a while you just see little tissues. So it depends at what time it occurred. If it occurs very early, there'll be no challenge. The body just absorbs it. But if it occurred in the second trimester, even at that, we don't do anything about it. But the good thing is that for most women who are carrying multiple pregnancies, the babies are in different sacs. They have different sacs, different placenta, so they're able to function independently of the other. All right, but such a woman will need to be closely monitored while uh, she's going through pregnancy, so that whatever caused the death of the first one may not affect the second one. Because if it happens in in the third trimester when you're the age of viability, then what you need to do is to just wait until that you can deliver the baby. And you just deliver. You don't have to wait till you get to 38 weeks thereabout. You have something occurring at 34 weeks, 35 weeks. Because you're not sure what caused the death of that one suddenly, it's better you just go ahead and terminate and deliver the other baby. All right. At that point, you have to deliver, and then the one that is not alive will come out. But if it's something that occurred very early, the body takes care of it. Okay? All right. Question? Yes. You know, up to now. Okay, so sleeplessness is one of the symptoms of pregnancy. So before you got pregnant, were you sleeping well? Because some people they have issues with sleeping right from even before they got pregnant, and it will probably get worse. But generally, when you are pregnant, you will have issues with sleeping. All right, but typically those problems usually occur when the pregnancy is already advanced. Okay, so and then if you're having a lot of headaches, then we need to check one or two things. We need to be sure that you're not hypertensive, your blood pressure is not high. If your blood pressure is high, then headache is one of the symptoms you will have. And then if you are taking antihypertensive, some of those antihypertensives, um, they could cause, as part of the side effects, is that they could give headache, like nifedipine. All right, and then if none of those is present, the hormones of pregnancy also can sometimes give you headache. The fact that you're not sleeping well can also be the reason why you're also having headache. All right, so you need to, and all of these are all as a result of hormones, the hormones of uh, the hormones of pregnancy. So what we need to do is to evaluate you, make sure you're not having malaria, because if you have malaria too, you can also have headache. Rule out all of these things and give you something to calm you down to make you sleep. Hopefully, with that, the headache will subside. All right. Okay. Question? No question? Yes. That's normal now. Okay. Mm, it's normal. So when you say stand for long, how long? Ah, it's not. And you stand in one place. It's not good. Even normal somebody standing in one place. You see how I'm walking around. Eh? Is because when you stand in one place, there's no circulation. You understand? So it's not good for you to sit in one place or stand in one place. All right, you must always ensure that you are moving. Okay, it helps circulation of blood. Is the position that okay? There are two, no, not two. Let me say three main positions that you can adopt. You have the left lateral, you have the right, and then you can sleep face up or face down. When you are pregnant, this one after first trimester, this one cannot happen again when you sleep on your tummy. And the one that will not be um, either sitting. There's space in front here, please. No, it's not reserved for. It's no, no, no. That's, we're all VIPs here. All right. So you sleep on your left or on your right, particularly when you are now in your second and third trimester. If you're in your first trimester, sleep anywhere. Oh. Don't start sleeping on your left because by the time you get to halfway, you will get tired. And don't say, doctor said I should be sleeping on my left side alone. Meanwhile, they just confirm pregnancy. Why are you sleeping? You can even sleep on your tummy. There's no problem. All right. After the first trimester, as the tummy begins to come out, the reason why we say you sleep on your left or right and not on your tummy is because you want to avoid the pressure of the uterus on your vessel. All right, the veins that takes blood from your legs up into your heart. In fact, you can't even be comfortable if you sleep like this with your big tummy. No, so you need to turn to one side. So sometimes it can become very difficult to get a good sleeping position. Once you sleep on your left, this leg is already tired. You'll be sleeping on that side. Then you turn to the right. But sometimes when you turn to this side, the baby will now begin to react and say, mom, why you stopping me? My friend is sleeping on one side. So baby will now begin to react. Calm down. This place is weak. Baby wants you to sleep on that side. And then you have to turn to the other side. So sometimes you may decide to recline. Some people sleep better on the chest rather than on the bed. If it's on the bed, you have to get multiple pillows. No bed comes with two pillows. This one you get extra two, extra four, so that you're able to pad it very well. One pillow will support the tummy here, that one will support it here. One will be on the leg, then two at the back. Mm-hmm. On the baby side. No, no, no. That is how it feels like because that is usually it's not a position that. All right, so sometimes it feels like that, all right, because the baby is also reacting. So you just to make sure you sleep on the other side, all right, and then sleeping patterns also may now begin to change. You now suddenly realize that at night you cannot sleep, you sleep during the day. What is happening that your body is getting prepared because when you deliver, babies are awake at night and they sleep during the day. Yeah, so the baby is getting you ready for the job, for the assignment that is to come. All right. Okay, same question. Okay. Yes. Muzzle pull. Is he hitting it very hard? You tell him to hit it. Uh, no, no. Muzzle pull. Muzzle pull It's common. It's common. So once you do, just a massage it, basically. It's not a challenge. So husbands, assignment for you. You were begging him, and he was doing shakara. Driving on bad roads, potholes. Of course, when you are carrying a pregnant woman on the car, the way you drive must change. Bef- the car, you go gently. You enter pothole with style. You go in, you come out. Not no, 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 no. The discomfort alone that the woman will feel, all right, it's not a joke. So when you have a woman that is pregnant and you are driving, please, extra caution. That's what I would say. Uh, hmm? Okay, so another question? That they cannot take. Pineapple is good now. See, even internet, all manner of things are there. Some will say pineapple is not good. Some will say orange is not good. Some will say pawpaw is not good. Which one is good? Meanwhile, some have said pineapple is good for implantation. So another one, spinach. Don't have a problem with spinach. Spinach, vegetable. But why do you want to drink it raw? For see, for me, there's this comedian that says, stick with what you know. What you've been using for where that you grew up with, that you have been eating before you were pregnant, continue with it. The most important thing is that you are eating well, then your food contains is balanced diet that contains carbohydrate, protein, fats, vitamins, and minerals. Then we will supplement it with the hematogens that we give to you when you come to the clinic. Speaking now, you are good to go. All right? Okay. Questions? Okay, no problem. Mhm. Oh, please ask it. Ask it. Okay. Dressing. Okay. Ah. No, it's possible the husband has reasons why he doesn't want you to. He wants to. He wants to respond. Hmm? Very tight to affect the baby. Okay, so let me say this. Okay, where that baby is, hmm, there's no amount of cloth or tightness that will affect the baby. Okay, the, for that baby to be affected, the person wearing the cloth, the one that affected will be affected. You feel it because you are constricting yourself. The discomfort you will feel will be such that you won't be able to cope. All right, and then there are these maternity trousers that you buy that it has elastic. Yeah, so that is what we normally advise. So of course, Oga has a point. Don't inconvenience yourself. because he's interested in both you and the baby. And so there's a moment they must wear trousers, so they'll be trying force it to button. Go and buy the maternity trouser that is tight. That one you don't need to, it's just elastic. It can expand. Okay? Good. All right, so question on? All right, so I want to once again thank all of our esteemed clients. Thank you for coming. And for those who um, watched online, any questions online? None? Oh, okay, they didn't have questions today. So I want to salute every one of you and thank you for taking our time to come. And for those who joined online, I want to say that we are very honored to be given the opportunity to manage and to take care of you. It's a privilege that we don't take for granted, and we will continue to provide you with service to the best of our abilities. At any point you think you're not getting the service that we promised you, please reach out to us. Okay? And then just let us know what you feel. We will make all the necessary adjustments. We are here because of you. And I want to wish all of our pregnant women a very successful journey. You will all deliver safely. And I look forward to having your babies. So the pictures, for those who will deliver here, I wish all of you will deliver here. But I know that there are some people who are planning to deliver in Canada, deliver in US. It's okay. And me, I'm praying that one day we will get the capacity to give. I know what the reason why they are going. It's not because of the fact that they get better service. Eh, we know the reason why some people they are thinking about future. All right, but we promise to offer all of our clients the best of service, and I know that you will have a wonderful time. So once again, thank you so much. And then for those who would have delivered before our next antenatal class, wish you the best and have a safe delivery. And until we see again, first Saturday of next month, have a wonderful time and then see you at the clinic for your antenatal clinic visit. All right? God bless you. Have a wonderful weekend. So just hold on, they'll give you the snacks. Okay, I'm told that there is now fuel scarcity. Maybe that's why some people did not come. They couldn't come. Serious one. Hmm. It is what? Wow. Are you serious? Okay, that problem that happens in Kogi, that river, this thing. Wow. Yes. Chris, how are you? Dele? How are you doing? Dele? How are you? Sir, thanks for coming. I appreciate it. Oh, Father, thank you, Jesus. Hallelujah. Yeah.
Family products take this
Congratulations to Joje Hospital. God bless you all. Have a lovely day and enjoy your celebration. Thank you.
Glory be to God for making this day a reality, counting my family by name, Mr. and Mrs. Taiwo, counting us as part of the family the Lord has used Joje, Joje Hospital to make our dream come true, blessing us with a wonderful children. I mean, twins. The Lord has really used them for us. Using this medium to express our gratitude for their hospitality during this procedure, right from the reception to the upper to the top management, how they have received us, how they have meticulously